So today I hope everybody joins in very early, as early as possible, because otherwise very less time I get for your question and answers. Yes, so I'll wait for some time for a few minutes before I start the YouTube live. So welcome Dr. Vishal Katoch. What happens, why the importance of rubric selection, rubric selection is such an important part in our prescription. Whenever you take a case, you basically get a very beautiful story of the case. There is a beautiful story of the case, and from that story of the case, you have to now interpret the rubrics. Every patient will not tell you rubric-wise case taking. From the whole case, you have to make a summary and then see whether you can get a rubric from that summary. So once you take a rubric, it is such an important thing. Make sure that once you take a rubric, it basically defines the whole personality of the case. And once you take a rubric, it should define the personality. And secondly, if that rubric is right, then it basically eliminates a lot of other rubrics. That is important. So welcome Dr. Maya, Dr. Meera. For example, there are some cases which come to us where the patient says that my father and my mother, or my chacha, my chachi, my grandfather, my grandmother were very good and they gave me everything in life, but they didn't allow me to do this. If I was allowed to do this, I would have been a different personality. No, they were not dominating, but they used to continuously give me a lot of advices, and that's why whatever I wanted to do in life, maybe I could not do. If this case comes to you, this is the basic gist of the case. You can take a lot of rubrics, but whenever the patient says that he was not dominated, they are just told that do this, and I used to follow them because they were seniors and they were my parents or my grandparents, anybody. So what rubric comes to your mind for selection? This is so important. Otherwise, you always take elements from dominance or spoiled children and prescribe the remedy, and that's why we fail in our prescription. Now, this is the gist of the case. What rubrics do you find which will come in your case taking, or what rubric you have to select to get to the similum? Anybody? Welcome Dr. Gyani, Dr. Maya, Dr. Vishal, Dr. Meera. Which rubric comes to your mind that will basically guide you for a similum? We have a lot of doctors, some on online. Admonition, yeah. Anything else? See, if you take that rubric and that signifies the whole personality, I have told you the whole case in just 2 or 3 lines. So one, Dr. Meera says it is admonition. Anything else that comes to your mind? Very clinical. And that's why, what happens? Sometimes you feel that remedy is such an XYZ remedy, and suddenly in a rubric you find that remedy given. For example, jealousy between personalities. You can never think that carcinosin would come in your hepatitis, but carcinosin is there in the rubric jealousy also. But we have been taught carcinosin as a beautiful child, a diligent child, a conscientious child, a social child. But that, if you take the rubric jealousy, carcinosin is there. So we have one more answer, that is will contradiction of. Dr. Anja Smith, welcome. But here the patient says that he was not dominated, he was not forced to do anything, but he feels that I thought that, and I asked my parents and they said don't do this, do this. At that time I followed, but now I feel that maybe that thing which I wanted to do, I could have gained something more in life. So it is not will contradiction of. It is not dominance. So what it is? Dr. Tejuk, welcome. Dr. Ansuya on Instagram. So what this is called as, and if you think I gave that patient a single dose of platina. I gave that patient a single dose of platina and it came out beautifully with the medicine. Antagonism, no, antagonism, will contradiction is something other what we think about. That's why rubric selection is such an important thing, So I took a simple rubric, elements from, remember the rubric, elements from admonition but kindly. See what the patient has told, he was not forced, there was no dominance. That's why it was elements from admonition kindly. And a simple rubric a simple remedy which I prescribed is platina. Now, can you ever think platina, which you have been taught as a superiority complex remedy, casting away by wills, feels she superior, but elements from admonition kindly. This is the beauty of understanding a rubric, and this is the beauty of understanding the repertory thoroughly and what to prescribe and what not to prescribe. Because once you think of platinum, the first symptom that comes to our mind is superiority complex. But these elements from admonition kindly will not come to your mind, and you will miss platinum just because of the selection of rubric is not up to the mark. This is the importance of selection of rubric, and this is how we have to basically try to select the rubric on the basis of the summary of the case. It is said that if you prescribe on 2-3 rubrics, depending on the disease, for syphilitic severity rubrics, you will get much more result than prescribing than taking 8 to 9 rubrics. That is what I have seen in my practice. For example, I'll tell you one symptom and one case also. I had a case where the mother came and told me that my child gets angry at anything. He just gets angry by anything. You cannot tell him anything. He will become angry, and we don't know why he becomes angry. Now, if this child comes to us, we have to we basically think of angry remedies like chamomile or nux vomica or maybe graphitis or ferrum or phosphorus or platina. But how will you interpret this rubric? That is very, very important. The mother comes and says that my child is so angry, child, please treat her anger. We can't tell him anything. He becomes angry very fast. Yeah, good afternoon, Dr. Kocher, Dr. Vaishnav, good afternoon. So this is the case. Now, what remedies or what rubric comes to your mind when you are trying to prescribe? And I prescribed that remedy. I prescribed that person a very, very important, a very, very maybe less used remedy, and that was Nicolum. I prescribed that patient Nicolum carb. Now, if you see the anger causeless, now you see whenever you have anything else, okay, I'll ask something. Dr. Vishal said this is called as anger causeless. Anything else that comes to your mind, anybody? There are a lot of doctors, senior doctors watching the Instagram and YouTube. Anything else that comes to your mind? So we have two things to see in this case about anger. And whenever anger comes, we have in our mind the so-called angry remedy, anger trifles. Okay. Anything else? Anger trifles. Okay. Now, for trifles or this, there has to be some trifle cause also, no? If there is no cause also, he becomes angry, then it becomes anger causeless. Okay. But if you go and see the Mater Medica or the repertory, see there are a lot of other things like for example, if you are taking anger causeless, the remedy is absolutely different. There is, but this patient, you have to think of two rubrics which are very, very close. One is anger very easily. Simple rubric. Don't interpret things which are not to be interpreted. Remember my sentence. Don't interpret things which are not to be interpreted according to what you want. Simple rubric we have anger easily. हर छोटी बात पे उसको बहुत तुरंत गुस्सा आ जाता है. That is a very, very important thing. Be very simple in your practice. Angered easily, we have beautiful remedies, and angered easily, don't forget 3 or 4 remedies which were very, very important. Clinically, I have seen, I don't know what is written in the repertory and Mater Medica. The first is Lycopodium. The second is Nux vomica. Third is Thuja, and the fourth is Phosphorus. Good afternoon, Dr. Amit. These 3-4 remedies are such important remedies where the patient comes and tells, angered very easily. Of course, there are 20 or 30 remedies like you have chamomile, you have ferrum metallicum, you have platina, you have phosphorus, thuja, zinc. But these 4-5 remedies like lycopodium, phosphorus, nux vomica, ferrum, these are so very commonly used in my clinical practice, and I have got very, very good results because of that. Of course, try to find out the cause of anger. Whenever a patient is angry, there is basically a grudge in him, what he cannot perform, what he cannot do, Sometimes because he feels that he is worth more than what he is now, and sometimes because that he is not got the worth what he is liable for, and somebody else is getting what he should get. These are the cause of anger. Then the anger starts. So it is very important, one point also, to see why the patient is angry and then start prescribing. That is a very, very important symptom to see. Then you have a lot of other sub rubrics for anger, like anger from fright, or anger from heat, or anger with himself, or angry with interpretation, or angry because of jealousy. But the basic rubric has to come. Once you prescribe on the sub rubrics, then you have only 1 or 2 remedies. Of course, in the recent repertories, if you have the addition of 2020 repertory, every sub rubrics or every main rubrics have got a lot of remedies. But when we studied repertory 20 years back, our repertory had only 1 or 2 remedies for the sub rubrics. That's why this is called as anger, easily. And then the frequency and the masm of anger, that is angry so much that he could have stabbed anybody. Then your remedy changes. Or anger sudden, or because of anger he gets suffocated. Then it is a syphilitic part, and then you can always go and prescribe on this. So this is what is important in a rubric selection. Once you take a rubric, then it becomes a part of that patient's personality that should depict the whole personality in that one rubric. And of course, you can add 1 or 2 rubrics depending on the miasmic schedule of the patient, so that your remedy is the simillimum. So this is what I wanted to tell you, something about rubric selection. I hope you got it. And if you have questions, you can start asking questions. Otherwise, I can go on and on in rubric selections. Yes, any questions, preferably on the YouTube, because everybody can see. Yeah, welcome Dr. Sultan, Dr. Egi. Please join in early because, Dr. Vishal, 133 remedies, for the same rubric. And that's why the more latest repertory you have, the more remedies it is in that. For example, I told you about the rubric abrupt, and also then it becomes very confusing for the beginner or the fresh practitioner. If you repetize for 3 rubrics also, there are about 20 remedies all covering that rubric, all medicines, and then it becomes difficult. That's why I tell you, when we started using repertory 1995, we had about 3-4 remedies for that rubric, and that's why it became very easy for us to select from that. And if you ask me, I'm very happy with that, and it has given me very good results. For example, if you see the rubric, if anybody has, for example, Fatak repertory. If you see Fatak repertory, if you see the rubric precocious, there are only 2 remedies in Fatak repertory. But if you open complete repertory, of course, 1995 edition, there are about 20-25 remedies. Then if you open complete repertory 2020 edition, there are maybe about 70-80 remedies. So it becomes very difficult for the newcomer to basically prescribe, because there are so many remedies in a single rubric. So best of luck for that. Good afternoon, Dr. Anja Smith, Dr. Nazbuddin. Yeah, welcome. For a C esophagus or a malignant case, if a patient came especially for cancer, what's your approach? Yeah, see, if the patient has come for cancer and the patient is suffering from C esophagus, first of all, it is important to ask, are there any defining feature of that cancer symptoms? Lately, just about a month back, I had a case of cancer of lymph node, and one of the doctors, she's not there now, she had taken the case, and the patient just came last week, and the swelling has reduced and the cancer symptoms are much better. He has started eating and he's much better. We approached this case constitutionally. But in case of C esophagus, sometimes the most important symptoms is vomiting. Sometimes the most important symptom is vomiting of what? Like blood or coffee ground vomiting, lot of choking, the patient cannot eat. In this case, it is very important to first relieve the symptom. What I do, like if you have a case like this, 1 or 2 remedies are very, very important. The first remedy that you should think about is Kondurango. Kondurango is a very, very important remedy. Acute phase can be settled. Of course, if the patient again has a very defining feature of this case, for example, I had a case of cancer lung, and when I visited the patient, I could find that the linen the patient was wearing, because of perspiration, the linen was torn. So very corrosive perspiration, and just by seeing that symptom, I prescribed the patient Mercor, and he responded very beautifully. So whatever symptom the constitution is showing in front of you, that is the syphilitic symptom that you have to take for prescription. That's my approach. Dr. Amit says, Dr. Nidhi says anticipation. Dr. Nidhi says admonition, aggravation. Dr. Nidhi, sir, what is your psychodynamics every disease? There is so many, but used to less. Can you throw light on? Yeah. See, I'll just come back, Dr. Bajpai. Just I'll finish with Dr. Vishal. See, there are a lot of remedies. There are a lot of rubrics for delusion. Now, if you find that the symptom of delusion is very, very important and prominent in the patient, then you take it, or otherwise you can forget the rubric. Whatever rubrics you are finding it difficult to understand and interpret, forget it. There are so many symptoms the patient gives you. You can enter the case automatically by that, what you feel you are very savvy with. So don't get stuck that if some doctor is telling you delusion is the most important, I took delusion, that is like XYZ. So don't get stuck on that. Basically work on your positive. Basically work on your strength. Not because some others are getting result by this rubric, you also take it. It is the confidence in yourself and the strength of what you have. Work on that rather than comparing. That was my approach 20 years back, and I can tell you I'm a very successful doctor. Good number of patients and good results I have. Learn from everybody, but think on your own. And yeah, so psychodynamics. See, please explain slander disposition. Just give me some time. I'll just see psychodynamics. It's a beautiful word, but psychodynamics covers a lot of things which you have to take into account. Every disease, has a very, very important expression in the form of somatic symptom, but it should have some the psychic symptom also. For example, I'll just narrate a case, a beautiful case, and when I prescribed and gave result, I thought, oh, I missed so many times. There was a schoolboy. I'll just explain you. There was a schoolboy and he was playing. One of his friend came and just tapped on his back near the scapula. And the patient, just a little tap, and the patient came with too much pain in the muscles of the scapula, could not lift the hand also. So as usual, he was prescribed Ruta, Belisper, Arnica. Nothing worked, Nothing worked. And after 10 days, the patient again came to us. So my assistant said, sir, this is the case. It is not working. You give the medicine. So he came to me and I asked the child, what happened, So he said, uncle, his MRI scan also was normal, So he said, doctor, basically, he said, uncle, that the injury was not so severe. He just tapped me on the back. I said, yeah, so what is the cause? So he said, sir, I don't like to meet with people now. I find I like to be silent, and people came and tell me, where is the old one in you which was so mischievous? It is gone. So I asked him why it is. Okay, sir, I don't want to meet. I feel that what is there to talk? And I am not selected for some ceremony in the school, and I think I am useless. I think I must have done something wrong. That's why God is basically not with me. So I'm wearing one thread. This was the history. Now I gave that patient, which remedy comes to your mind? I gave that patient single remedy, 1 dose, and came and told him to come after a week. Mentally he was out. He was as he was, and the gradually pain subsided after a month's time. A simple case. Pain here, lot of muscle painful. Arnica, Belisper, Ruta. I think 1 or 2 medicines more were given. No change. Came to me. I just asked for 5 minutes, and the case was through. What remedy comes to your mind? The psychodynamics. Anybody? And such a simple case, such a simple thing. I gave the patient a single dose. Anybody, any remedy come to your mind? Dr. Hema Kulkarni, Dr. Basin have joined. Any remedy comes to your mind? Anybody? Anybody? No question, no answers? At least try. Belisper, I told you, Belisper was given, Ruta was given, Arnica was given, sulfur was not given. स्टेफिसेग्रिया, ओके, एसिड फॉस, आप ही करा सकते. एनीथिंग एल्स? बट यू हैव टू हैव रीजन, यू नो. I prescribed the patient hypericum. Yeah, hypericum also was given, Dr. Tejo, good prescription. Now open the books of Mater Medica. See how beautiful, it is. Whenever there is pain in the right scapula inferior angle, which remedy comes to your mind? Anybody? Which remedy comes to your mind? It is such a simple remedy, but we made mess by giving this arnica bellis per root, a lot of remedies. Which remedy comes to your mind? It is written in black letters, it is written in italics, that remedy. Which remedy comes to your, anybody? Dr. Meera, pain at the inferior angle of right scapula. Anybody? Yes, chilidonium maybe. You are right, Dr. Bajpai. Macphos is not chilidonium. How many times we have prescribed chilidonium? Just here, pain at the inferior angle of right scapula. And what is chilidonium? The patient feels as if he has sinned away the day of grace. See how the psychosomatic matches. Single dose of chilidonium and the patient was out of everything. No symptoms of liver complaints. If you go home and read chilidonium, it is written aversion to mental exertion or conversation. Despondency, feels like crying without any reason. That is chilidonium, and that was the patient. How was the somatic symptom? Pain at the scapula. Just by touch he got pain. All reports normal. Single dose of chilidonium 200 cured the case. This is the importance of psychodynamics. And that is why it is so important to understand why the patient is using a particular term or go beyond that. Go beyond that, and if you go beyond, automatically everything will come into its place. This is psychodynamics. A very wonderful question asked by Dr. Bajpai. See, everybody will know chilidonium, but have you ever prescribed chilidonium, pain at the inferior angle of right side of scapula? Whole symptom was matching. That's why first the mental state was there. He was chilidonium before he was hit on the right side. Just a simple trauma. Before he was not selected, before he was depressed, before he feels he has sinned of the day of grace, before he was feeling not to talk, before he was feeling not to converse. And then the whole state of chilidonium was there in the constitution, which the patient did not come for because he felt that was normal. And then the body wanted the similimum. That's why the body had to show some symptoms on the the somatic level so that we could prescribe. That's why whenever I send a template, I've sent a template. If you have seen my template, unless you get a similimum, the body will try showing out symptoms. Remember, my every template which I basically send you on what's the group is my clinical observation and my clinical experience of 25 years. This is how the body shows the symptoms of mind. Did you get what I wanted to tell you? This is psychodynamics. Everybody will give the answer chilidonium, but on the first instant, who will think about chilidonium? Everything is written in the books, no doubt about it. But it is for us to interpret. You can become a very researcher and scholar, and you can give beautiful lectures. Beautiful lectures by to the students. But see, a simple symptom of pain in the right side of scapula, simple remedy chilidonium, we never got, because we took always the symptom of trauma, and arnica bellis per everything was given. Reading books is important, but application is the most important. That's why we say there's a difference between theory and application. Most of you basically, I think, are very happy with understanding and reading books and hearing those type of lectures. But as I always say, whenever I am giving a lecture or explaining something is only clinical. I sometimes maybe not following the books because I have got this type of symptom and this type of results. Chilidonium, which I never thought would come in such a child of 10th class, and we could cure that complaint. WhatsApp classes, yeah, I'll send the number to you, Dr. Bajpai. Did everybody get chilodonium? Yeah, a lot of doctors on Instagram, Dr. Bharati, Dr. Fatima, Dr. Lammi. I think you joined late. But this is how the psychodynamics, Dr. Vajpayee, works, and it is sometimes, we always feel that you have to take the whole case, you have to give an hour to the case, but sometimes the simple question about why did the disease occur is so important. And moreover, if you find that there are a lot of symptoms in the body and the patient has no the patient has all reports normal, then it is definitely something hidden inside his sora, inside his constitution, which you have to dig it out. Welcome, connection failed. Okay, so this is why I welcome Dr. Belwalkar. I have one more beautiful case. A case came to me with a lot of depression, so much depression. About 15 years he was taking medicines. He was lean, thin, always weak, always taking saline, but no change. So he was with his missus, and I asked him that you have any wrong habits and all, any suppression, and he told me, I have lot of sexual instinct, I have lot of sexual but always I was told that it is bad, it is bad, it is bad. I had no freedom to do what I wanted, to talk to girls and talk to this and talk to, even after marriage also I cannot tell my wife directly that I want that sexual pleasure. And a simple remedy I gave him. Which is the remedy? 15 years on psychiatric treatment, no relief, just one dose of phosphoric acid cured the case. This is the importance of asking the history. See, if you take a case who is in depression, he will give you such a beautiful case taking, such beautiful rubrics, 10, 12 rubrics, and you say, oh, we have got the case. But the more rubric you take, automatically you are basically prescribing other medicines. You have to have the cause, its effect in the body, and the case is there. I hope you understood that phosphoric acid case also. It's a fantastic case which I just cured maybe a month back. It's fresh in my mind. I gave him the phosphoric acid 1 single dose. Because the thought of that sexual was suppressed, and now he's suffering from such weakness. He's become lean, thin, debilitated, does not come out. So Allen's keynote, first line, phosphoric acid, go home and read. I have told you several times. Go home and read Allen's keynote, first line, and you will get what I mean. What I'm telling about phosphoric acid. Of course, the sexual suppression and that habit, and that's the case. Always remember that first line of Allen's keynote. If you have not, I always remember the line. Best suited to person of originally strong constitution who have become debilitated by loss of vital fluid, sexual excess, or long succession of moral emotions as grief, care, disappointed affections. Disappointment is so important. Phosphoric acid. I hope you got the case. Dr. Bilwalaga, what made you select phosphorus in this case? You posted on WhatsApp. I told this case on the last YouTube only, Dr. Bilwalkar. So if you go on my last Saturday's YouTube live, I have given the case and given the reason which I prescribed phosphorus. A beautiful case. Today also he gave me a WhatsApp message that she is doing very well. Now she is walking and she's eating and she's very happy. So the septic arthritis or synovitis or what was diagnosed, an operative case, nothing, and the one I think 2 doses of phosphorus has cured the case. I have given that on last my YouTube, so please go and see my last YouTube live. I have explained why I gave phosphorus. So next question. I hope I am audible, and I hope you are following my word, because I'm a bit fast, I know that. So just keep a track, keep your ears very alert so that you can get what I want to speak. So we have done 2 cases, phosphoric acid 1, beautiful case, and chelidonium. Chelidonium is a fantastic case, but because I think a boy of 15 years, pain in the scapula, especially only on the right side, and sent out the day of grace, very depressed, does not want to talk, does not want to come out of it. What a wonderful remedy, chelidonium. You can never think of such a tribal trauma and chelidonium, such a psychic cause in the chelidonium. That's how homeopathy works, and that's how you have to keep on understanding the psychodynamics of the case. A wonderful question asked by one of the doctors, and There are a lot of cases which I can discuss, but let us go slow and understand every case in a deeper aspect. Dr. Sharon, Dr. Tejuk, I hope everybody, lots of people are joining on Instagram. I hope you're understanding what I want to tell you clinically, what I have seen in my practice. Okay. Next question. A lot of people ask me that when the mind is very unhappy, the mind is very unhappy and you feel a lot of weakness in mind, what remedy to prescribe? Now see, weakness of mind, if you go and mind is not unhappy and basically has a lot of prostration of mind for grief, stress, and all, you have remedies like ignitia or natramur or calibrom, a lot of remedies. But understand why the mind has become weak. Understand why there is weakness, lot of trauma, lot of financial trauma, or lot simple, sometimes doctors come to visit us that doctor feels, oh, I'm so tired, I'm feeling so weak, not because of grief and all, because of his work. He's working 12 to 14 hours per day, seeing a lot of patients that are sleepless nights. That's why he's become tired and weak. In those cases, ignitia or natramur or calibrom will not work. That's the intellectual weakness. So remedy would change. Then you have to prescribe remedies like picric acid and those argentum nitricum and those remedies. So whenever these type of cases come to us, don't just jump into the remedies like ignitia natramur. There are a lot of other beautiful remedies we have with very, very precise indications. Dr. Vansh, welcome. I hope you understand, everybody. I hope you're getting it. There's no answers, yes, nothing. Yeah. So I think only one doctor has understood. Everybody is not understanding. In tinea infection, which important rubric should be taken? Yeah, good. So in tinea infection, I have already, Dr. Smith, Dr. Nidhi, thank you so much. So whenever I'm explaining something, clinically, so if you tell yes, no, then I also get confidence that you're understanding what I want you to understand, so that clinically you improve better. One question from Dr. Tejuk, tinea infections, tinea infection, there are a lot of remedies. I don't take rubrics, I take symptomatically the remedies. I told you some remedies in my previous YouTube lives also, like you can think about teucrium, sepia, azadirachta, echinacea, and all this tinea and fungus and infections basically are because of low immunity. So find out why the immunity has gone low, and it is basically consultative prescription that will cure those complaints. Otherwise, the acute remedies you give, it goes, it comes, it goes and comes. In tinea or fungus or virus or ringworm, case taking is important. Acute remedies, you can think about what I've told you, and you can get some result also in those cases. So any more questions, or we are done with this today? Anybody? Dr. Palak has joined exactly half an hour late. Any more questions, or I'll do something, do a case and then maybe. See, anger easily again is a very, very important symptom. Any specific literature to strengthen our knowledge? Oh my God, there are so many literatures, Dr. Vansh. I think we are flooded with literature. I think before also and now in social media, you open any group, you open any page, there are floods of knowledge. Sometimes it is that it is called too many cooks spoil the broth. It's like that. One remedy, and in one WhatsApp group, the theme is something different. In some WhatsApp group, the theme is something different. In Facebook, it is something different. In one, you is something different, and you're confused about that remedy from where to read and from whom to follow. So my sincere advice, it would be follow the persons basically who are giving some clinical knowledge practically, showing you the cases before and after. And the Mater Medica, basically read the basic Mater Medica. Basic means you can start with Allen's keynote, then you can go to Kent, and then if you find interesting, you can see Clark or Boger, and then you can go on encyclopedia and all. But normally, what I did in my college life was Allen's keynote, then Kent's Mater Medica, and now then Clark Mater Medica. Hashimoto's disease since 2 years, age is 20 years. Yeah, Hashimoto's disease, basically it's an autoimmune disorder. So autoimmune disorders, basically constitutive prescribing is very important. It is autoimmune. There is something in the patient's life basically which is triggering that is killing himself, that's triggering the patient, killing the patient from inside. So do ask that part of that patient's case taking, and then you can get the remedy. Dr. Vansh, completely understand. Yeah, thank you so much. Does mother tincture help in hair fall cases? Dr. Teju, yeah. Maybe 10, 12 years back, I used to use some mother tinctures which I was basically told by my seniors when I saw them using. They used to use mother tinctures like Amlaki, Brahmini, and Jaborandi. So you mix that 15 drops of that mother tincture in the oil which you apply, and then apply on the scalp. I don't know whether it works or not, but that was told by my seniors 10, 12 years back. I used to use that, but now I don't use that. I use the miasmatic approach. Dr. Teju. Dr. Muru Segedi, welcome. Dr. Sharon, hello. So I hope you understood something about clinical side and something about the approach you must do in case taking and what to see and what not to see. These are very important and short tips. It's not tips based, it's the approach which I basically told you. Somebody had asked me something about psoriasis approach again in my WhatsApp group, but I've been telling you there was an Instagram live for 1 hour. I was interviewed by Dr. Anam Zahir. You go to that Instagram and just see the approach of treating psoriasis, what I feel and what I have got good results in case of psoriasis. And I have shared the link of few videos also. You can see the before after and the cure of psoriasis. So you can click on the link and then you can get a lot of cases which I have put of the psoriasis before after treatment. So it is there, and I hope you go and see the YouTube videos. So it's very interesting, you know. And that my advice to you will be just go and see. I have discussed something about allium cepa mine, you know, allium cepa mine, remedy which we only use for coryza. But if you see allium cepa mine, it's a fantastic remedy. Just go and hear my YouTube Remedic on allium cepa. Sir, whatever entering case it is, necessary to start with indicated nosode and then constitutional remedy. No. If you get a constitutional remedy, then that remedy has to work. Simple as that. That remedy is your everything. That's a simillimum. Because unless you get the simillimum, the body will keep showing symptoms. Nosode, don't take the inverted bracket nosode, just open up the case nosode. No. Allen's has written beautifully, it has to be taken as a constitutional remedy and prescribed just as other constitutional remedy. I hope you got it. That's how I approach in my case, in my clinic, you know. So I think it's done. It is already 10 minutes up. Everybody go home and see the last YouTube video that I have discussed the case of phosphorus and allium cepa mine in my YouTube. And the Instagram live on psoriasis, because it's important, because everybody keeps asking me questions on psoriasis. So for now, thank you until we meet next Saturday for YouTube live. Thank you so much.